Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I am currently completing my placement with the Organization for a Safer Space. Today, I'll be talking about autism spectrum disorder. In this video, we'll first look at what autism spectrum disorder is. We'll then look at some statistics, risk factors, symptoms, treatment, and lastly, we'll look at some coping strategies. Autism spectrum disorder is identified as a lifelong neurodevelopmental disorder characterized by varying severity of deficits in social communication, social interaction, along with patterns of repetitive, restrictive behaviors, interests, or activities. Prior to 2013, there were different subtypes of autism spectrum disorder, including Asperger's disorder and pervasive developmental disorder, not otherwise specified. However, the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, has categorized the disorders into a single autism spectrum disorder diagnosis. Autism spectrum disorder affects brain development due to an altered connectivity affecting the interactions between different brain regions. Many people with autism spectrum disorder can have delayed or no language development, intellectual disabilities, attention deficits, and weak motor coordination. Statistics. The rates of autism spectrum disorder in the United States has increased from 1 in 150 children in the year 2000 to 1 in 54 children in recent studies. In 2017, more than 5 million adults in the United States, or 2.21% of the U.S. adult population, had autism spectrum disorder. In recent years, this has increased to 10% to 17%. Risk factors. The common risk factors for autism spectrum disorder include older parental age, such as 50 years or older, low birth weight, or less than 1,500 grams, premature birth, or less than 32 weeks, having a genetic or chromosomal condition, such as tuberous sclerosis. Symptoms. Several symptoms are associated with autism spectrum disorder. Concerns are raised when children exhibit atypical behavior and do not reach developmental milestones. For typically developing children, the symptoms for autism spectrum disorder are typically present by the age of 1. Social communication symptoms include inability to babble by 12 months, no first words by 16 months, no wide smiling or making joyful expressions before 6 months, no smiling, making sounds or faces with people by 9 months, no back and forth gestures such as pointing before 12 months, lack of joint attention, difficulty with back and forth conversations, making little eye contact, not looking or listening to other people who are speaking, inability to respond to one's name when repeatedly called, loss of speech, babbling, or social skills at any age, and lack of empathy. Restrictive and repetitive behaviors include spinning, hand flapping, finger flicking, repeating words or phrases, obsession with details and facts, and repetitive interests and use of objects, such as lining up toys. Treatment. A child who receives an early diagnosis can receive earlier treatments to improve their developmental progress and reduce atypical behaviors. Behavioral approaches. The most well-known treatment is applied behavior analysis, or ABA, which is a type of therapy that aims to improve behavior by teaching and reinforcing new skills, using imitation, as well as discrimination learning. 2 ABA teaching styles are discrete trial training and pivotal response training. Pivotal response training is a home-based program in which parents can teach their child skills and motivate them to utilize these skills in their daily lives. A type of skill is to initiate communication with other people. Discrete trial training involves step-by-step instructions to teach desired behaviors or responses, which are rewarded, while undesired behaviors are ignored. Developmental approaches. Developmental approaches are often used in conjunction with behavioral approaches. Developmental approaches focus on improving developmental skills, including language or physical skills. The most commonly used developmental approach for people with autism spectrum disorder is speech and language therapy, which helps to improve one's understanding skills as well as speech and language. Occupational therapy educates people on how to live independently by teaching skills such as relating to people. Educational approaches. Educational approaches are used in a classroom setting. An educational treatment that is frequently used to modify behavior is TEACH, or Treatment and Education of Autistic and Communication Handicapped Children and Adults. This is a method of using the environment, often a classroom, to improve a child's communication, independence, and predictability. TEACH focuses on consistency and visual learning to improve outcomes. Social relational approaches. Social relational approaches work towards enhancing social skills and developing emotional bonds, which can involve parent or peers. The developmental individual differences, relationship-based models, also called floor time, suggest parents and therapists to engage in the interest of people with autism spectrum disorder in order to increase their communication opportunities. The Relationship Developmental Intervention, or RDI, model includes activities to improve desire and ability to engage in social interactions. Social skills groups encourage people with autism spectrum disorder to practice their social skills. Psychological approaches. Cognitive behavioral therapy is a common type of psychotherapy that educates people about the associations between their thoughts, feelings, and behaviors. A therapist can help a person develop new ways to think and act to specific situations. Coping strategies. There are several methods that parents can use to help their child cope with autism spectrum disorder, such as educating themselves about autism spectrum disorder to learn how to manage symptoms, improve their child's functioning, learn about their child's educational rights and services, and learn how to help their child prepare for adulthood and independence, or continued support in some cases. Parents can also build on the strengths of their children by engaging in their interests. Developing daily routines for homework and bedtime can be beneficial as it can reduce stress and confusion. Identify and avoid stress triggers. Prepare a child for change or hard situations in advance to reduce stress. Understanding and utilizing a child's learning style, whether verbal or visual. Encourage physical activity to build confidence and friendships with other people. Encourage healthy eating, and help a child get adequate sleep to reduce the worsening of symptoms. Feel free to check out the Organization for a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.